Good morning and welcome to New South Wales Health's COVID-19 update for Thursday the 10th of June 2021. New South Wales recorded no new locally acquired cases of COVID-19 in the 24 hours to 8 o'clock last night. 3 overseas acquired cases were recorded in the same period, bringing the total number of cases in New South Wales since the beginning of the pandemic to 5,421. 19,810 tests were reported to 8 o'clock last night, compared to the previous day's total of 22,496. New South Wales Health administered 15,484 COVID-19 vaccines in the 24 hours to 8 o'clock last night, including 5,399 at the vaccination centre at Sydney Olympic Park. The total number of vaccines administered in New South Wales is now 1,592,042. This includes 545,970 doses administered by New South Wales Health to 8 o'clock last night and 1,046,072 administered by the GP network and other providers to 11:59 p.m. on Tuesday the 8th of June. New South Wales Health is treating 30 COVID-19 cases, none of whom is in intensive care. New South Wales Health has been advised by Queensland Health that 2 confirmed cases of COVID-19 travelled through regional New South Wales while potentially infectious. These cases drove from Melbourne to the Sunshine Coast, stopping at places in Gillenbar, Forbes, Dubbo and Moree. Please check our website for a list of potential exposure sites which may be updated. If you attended any of these at venues at the times listed, please get tested immediately and isolate until you receive further information from New South Wales Health. Our investigations into the movements of these cases in regional New South Wales has identified 343 contacts to date. Anyone who resides, works in or has just visited these areas since the 1st of June needs to be especially vigilant for the onset of even the mildest of cold-like symptoms. We urge you to come forward for testing immediately if symptoms appear and then isolate until you receive a negative result. New pop-up testing clinics in Dubbo, Forbes and Randrara and Maureen are supporting the increased testing for the communities living or working in these areas. We have also extended opening hours at existing clinics in Moree and Parkes. Please check our website for locations and opening hours. New South Wales Health was also notified yesterday that fragments of the virus that causes COVID-19 were detected in the Castle Hill sewage network. This is the second recent detection in this catchment following the first on Sunday the 6th of June. This catchment includes around 8,400 people and takes sewage from the suburbs of Glenhaven, Dural, Kenthurst, Kellyville and Castle Hill. People who have recently recovered from COVID-19 can continue to shed virus fragments into the sewage system for several weeks even after they are no longer infectious. However, we are asking everyone who lives or works in these areas to be especially vigilant in monitoring for symptoms and if they appear to get tested and isolate immediately until a negative result is received. There are more than 300 COVID-19 testing locations across New South Wales. To find your nearest clinic, visit our website or contact your GP. Thanks very much.